Okay, so my name is Monse and I am an M2 at Pritzker. I'm going to be moderating the session today, and we have our presenters, Kathy, Wendy, and Dr. Ross. I'll let y'all introduce yourselves and yeah, let y'all take the reins.
I guess I can go first. So I'm Kathy Garcia Torres. I'm a fourth year medical student at USF. That's kind of like not really in the southern part of Florida, but more central western coast of Florida. So it's in Tampa, Florida. But yeah, I'm originally from Mexico, so happy to be here. Oh, and I'm interested in OB/GYN. I should probably say that.
I guess I'll go next. My name is Wendy. I'm a fourth year medical student at Georgetown, originally from Miami, so Florida. And my family is Colombian and Peruvian. Let's see. I'm interested in pediatrics. We'll be applying this year.
I'm Dr. Stephanie Ross. I'm the residency program director for obstetrics and gynecology at USF. And I'm also from Miami, Wendy. So afterward, I want to hear where you went to high school, because I was a high school teacher in Miami for a little while before being a doctor. My family is Cuban, but it grew up in Miami. So that's my background, and I'm really glad to be here with you guys today. Wendy, did you want to share the presentation, or Monse, will you be sharing?
Sure. Did you have it up, Monse?
I didn't have it up, but I can go ahead and pull it up.
Sure.
Cool, I got you.
Thank you.
Here we go. And you can just let me know when to click and when not to click.
Sure. So we'll get started with the presentation. So what to expect. Every rotation is going to be a little different depending on your site. Oh, I am not muted. But in general, my rotation was for 4 weeks, and that was because of COVID. I'm not sure if that was the same for Kathy. And then for my school, and I don't know if this is every school, but it's divided into labor and delivery, gynecological surgery, and or ambulatory care. My school had all three. And then you have an MBME shelf exam at the end, and there is, you may have an OSCE depending on your school, and you'll most likely have some sort of feedback session or something that you can request. Kathy?
Yeah, so I definitely had a very similar experience. Mine was not cut short due to COVID, so that was good. We had technically 4 weeks in our kind of like OB/GYN rotation, but we did have 2 extra weeks of gyne surgery in our surgery rotation. I think that's a little bit more specific to our program, but in general, we had 6 weeks. We did have an NBME shelf and also an OSCE. Feedback was more so as you asked for it, but we did have it with the clerkship director. With our once again with our clerkship director kind of halfway through the midpoint. So yeah, definitely a lot of similarities in that sense, Wendy.
Yeah. And then in general, just OB/GYNs are going to be the ones who are going to provide the healthcare for women across their life. And the focus mostly that I saw was disease prevention and the continuity of care. And we list some of the subspecialties that you'll see. Being new to medicine and being first gen, I had no idea of the range of subspecialties and the amount of just amazing work that is done in OB/GYN. I don't know if Kathy wants to expand on it.
I definitely agree with that. I think even as you pointed out, being first gen, sometimes our culture is kind of like, you don't really necessarily want to talk about what's going on in your sexual history, anything like that. So it was definitely eye-opening to kind of see that. And I think it's a very intimate rotation that you see having with these conversations. I would definitely meet these women for the first time, and they opened up to me about things that I don't think you ever open up to a stranger about. So it's definitely a very unique rotation. Definitely very intimate conversations and very sensitive topics to have, but obviously it was one of my favorite rotations.
I would definitely agree with what both of you have said. It is a rotation in a field of medicine where you're involved in a lot of emotional highs and lows. So when you're on GYN oncology, you'll be having end of life discussions. When you're on maternal fetal medicine, you'll be having beginning of life discussions, and a lot of complexity in the patient population. The challenges that I see a lot of students facing is that there's so much thrown at you all at once. You're doing outpatient, you're doing inpatient, you're doing critical care, you're doing OR stuff. So it's kind of hard to prepare for all of medicine, as you're going your rotation. Like, for example, on labor and delivery yesterday, we had students that were involved in C-sections and vaginal deliveries and seeing triage patients for non-pregnancy complaints with influenza, taking care of patients who were critically care and bleeding. Like, you could be called upon to do anything at any time. So it's difficult to be ready for all of it, but you should know that your faculty know that, and nobody expects you to be an expert overnight. So as much pressure as you might be putting on yourself, recognize that the people on my end of things know that you are very new to things and don't expect you to be brilliant at everything all at once.
So some of the things that I thought were important to be aware of, acronyms, I don't know if this is across the board, but OB-GYN, everything felt like I was learning another new language. So like Spanish, English, now medical English, and then OB-GYN. And then I think that it's good to know what the expectations are. And that's something that you can speak with your attending and your residents about. Know what your study tools are before you go in the rotation as much as you can, of course. And then know when is a good time for you to study. And that's something that you can gauge depending on your team. I just had a really great experiences just asking or being told even from the get-go, like, you can go now and study. And by that, it's just like to a little corner, and then I'll just like be on the computer and also keep up with the tasks that were assigned to me. And then OR etiquette.
Yes, I added that one because Wendy, I think you had your rotation last. Mine was in the middle, so I actually did not have surgery before I did my OBGYN rotation. So this was my first time, kind of scrubbing in. If you haven't shadowed, which I know a lot of, our first years and second years didn't really get too much because of COVID. This might be your first time ever, even understanding what glove size you are, ever understanding what size gown you are, everything like that. So really just asking, maybe even your fourth year medical students to kind of, if they have downtime, that's what we're here for too. We're always happy to help you. Like yesterday, I helped one of our third years scrub in because it's all new, and you don't want to be the first one to contaminate because it's very scary. So just kind of looking at videos, knowing the flow, how do I scrub in, knowing that everything blue is kind of sterile, even just understanding your place and where to sit or stand. You don't really sit in the OR, but understanding where your role is, and everything will come with time. But just kind of knowing that there are YouTube videos for you to watch, kind of seeing the gist of it. I think that was helpful and something I wish I would have done a little bit earlier.
Yeah, actually on that note, your techs in the OR and your nurses, they're just going to be so fundamental to helping you in everything and teaching you. The whole team is really great about teaching, but asking, like, are there any like tasks you want me to get ready? Like, so for instance, whenever I would go into an OR, I make sure I pull my own gloves, I pull my own gown, or ask if those are already pulled. I put my name on the board if there's a board, usually my full name because they need to put it into the system and things like that, which I had no clue about. And then they were the ones who taught me how to like there's like this little, I call it the salsa turn, like in salsa dancing, because there's like a way that you do everything, right? So just steps. So for daily life, L&D for me was 12-hour shifts, and sometimes I was even there for longer. This obviously depends on your school. I thought it was great. We came in with the team, we left with the team, we presented like our specific patient that we were following, if 1 or 2 or even more. For me, it was 3 because it was my last rotation. And so I had more experience. And then in general, we had both AM shifts, so 12-hour AM shifts or 12-hour PM shifts. And I'm sure that that's different at different schools. Even at our school the year before, people were assigned for PM shifts only or AM shifts only, or depending on the hospital that you were at. And then in clinic and general gyne surgery, also for my school, it depended on like the amount of patients that we had and the complexity of the cases.
One thing that I want to point out about the daily life, especially on labor and delivery, is that like all the inpatient services that you'll rotate on, there's not really a predictable schedule to the day. But unlike some of the other services, the things that you're going to be called to do are time sensitive. So for example, if you're on an internal medicine rotation and you get called for a consult, you can stop and go to the restroom before you go to the consult. If you're on labor and delivery and you get called for a delivery, you need to go. Like, it doesn't matter what you're doing, you need to drop what you're doing and go catch that baby. Otherwise, the child is going to fall out of mom. You don't want to miss it. So there's not a whole lot of room for you to attend to things that you need to attend to. You could go a whole day and then realize, oh my gosh, I never had lunch. So keep in touch with your team, I think, is the best thing to do, is communicate with your team, finding out, using some situational awareness and not asking questions in the middle of an emergency, but also making space for yourself to go get your lunch, to, go attend to whatever you need to attend to, because the chaos of the day may make it such that you get to the end of your shift and you realize you haven't taken any time to do the things you need to do.
I concur. Just a little bit for us. I think like Wendy said, different schools will have different shifts or AM and PM. My school had 1 week of AM and 1 week of PM, so you might encounter that. I will say the PM shifts are a little hard to get used to because we have just like 1 week. So as soon as you get adjusted to that night shift, you're kind of back on AM. But that's the fun of it, and sometimes you might do things on the night shifts that you wouldn't be able to do on your AM shifts because there's less people. So definitely take advantage of every situation. I found that this rotation, the more that you do and the more initiative you have, the more you'll see and do in it.
Oh, the next slide. So this is my individual experience. So in general, I loved OB-GYN. It was my last rotation, so I did feel more comfortable in knowing what my role was and knowing when just knowing when to ask questions, knowing how emergent something was versus this is urgent. The challenging part of it was finding the time to study, like Dr. Ross was saying. When you're on L&D, the night shift was a little bit different, but the day shift, it was just everybody's working, there's so many different things going on at the same time, and you're a part of it. You're doing the magnesium checks every 2 hours for patients with preeclampsia. There's so many different things like that are going on. What did I like? I loved continuity of care. When I worked at the clinic, I saw my patients in the hospital and vice versa. And I didn't really like the night shift, but I don't know anyone who does like night shift in general, right? It's tough because you have to get your body used to it. But what I will say about the night shift, and Kathy alluded to it, is the difference in the cases that you see, which I think is why it's really good if you have the opportunity to do a night shift, because there's less staff sometimes, and babies love to be born early in the morning. So right when you're like getting a little bit woozy, you just never know what's going to happen. So that is something about the night shift that you could really look forward to. And what prepared me for my rotation, it was meeting with people from class, especially the block ahead of mine. Like I'd met fourth years, but someone who had just done it at the same location that I was going to with a similar team. You get to learn by asking about, what was your experience like? What didn't you find easy? What was hard for you? And then I loved the first aid OB-GYN clerkship book. To me, it gives you from A to Z, like, this is how you present. This is part of your oral presentation. When you're in the OR, this is what you need to think about. All these things that you don't know your blind spots. And when you're first gen or first time in medicine or whatever, if it's your first experience, it could be very distraughting. And more than that, because OB-GYN, like Dr. Ross said, has every aspect of medicine that you could possibly think of. If it's your first rotation on top of it, then it could be really intimidating. So then I like I mentioned earlier, I like to discuss at the my day-to-day what it was going to seem like. Of course, you never know and things can change, but just to have an idea of what my residents and attendings expected from me. And then what were the residents and the attendings like? They were wonderful. They were kind and caring and extremely accessible. The stereotype, and our clerkship director actually mentioned this to us. He talked a lot about what the stereotype is. Rude and bossy were some words that he used, but also at our particular institution, I think the surgical aspect of it, and this was both in OB-GYN and my surgery rotation, so that's why I'm thinking there might be an overlap. They didn't get the best scores. This is nationwide across the board. One of the things that I really noticed with OB-GYN is that they addressed it from the first day of our clerkship, talked about it, and the different avenues if any problems were to arise. So I didn't at all experience any of it. I didn't find it accurate at all. And then our patient population are women from diverse cultural and socioeconomic backgrounds.
I mean, it is truly every patient with a uterus, so it's really children, the elderly, pregnant, non-pregnant, it's really everyone. And I found that, as a medical student myself, I was such a huge asset to the team because I spoke Spanish. And like both Kathy and Wendy were saying earlier, it's such an intimate set of conversations that you're having. So you can imagine that in any field of medicine, the 3-step process of going through an interpreter makes things a little bit more stunted. But when you're talking about somebody's sexual history, when you're talking about somebody who's been through a rape, when you're talking about somebody's desires for pregnancy, contraception, these are very emotional topics. And so having somebody in the room who can speak to a patient in their native language makes a giant difference. And I don't know if Kathy or Wendy, if you've experienced this, but I know that I've walked into a room and hola señora, and their face just shines in the relief. And it's like, oh, okay, now I can say what I need to say. I walked in a delivery the other day and Kathy was coaching the patient through how to push in Spanish. And I mean, I could just tell the patient felt so connected to her. Like it's such a nice gift that you can offer these patients. So as valuable as you are in every other way in that aspect, you're going to really shine on this rotation.
I concur with everything that has been said. I think the finding time to study, it really is hard. The shifts, you get home, you're exhausted. But one thing I do want to say is I think OBGYN was the literally only rotation where I felt like what I was seeing was exactly what I was studying. So when I would go to my question banks, it was so applicable. Whereas because everything else was so broad, they would ask me like internal medicine, I would be, doing some random things and they would ask me about like Chagas disease. And I'm like, what is happening? So I think everything's very applicable. What you do and what you see in this rotation. The one thing I will say about attendings and residents, I completely agree. Everyone has been so nice ever since day one. It's the only thing that is a little bit hard to is with labor and delivery, there are so many attendings that you kind of cycle through. So it is hard to have, that continuity with an attending. My piece of advice, just introduce yourself to everybody. Be like, hi, my name is blah, blah, blah. I'm, the third-year medical student, and introduce yourself to every resident, because even though you might see another one tomorrow, it's always good for them to know that you're there.
Next slide. Thanks, Muncie. So study strategies, I think you probably have heard this before, during your preclinical years, but limit the number of sources that you choose to study from. I found a lot of these very helpful. I like online med-ed. I had a really hard, long drive, about an hour, through to one of half of my rotation. So I would actually just put it on in the background and listen. And I made sure that on the way there I would listen, and on the way back I called my mom. So, find your happy medium, right? Because otherwise you'll get tired. I was listening to a podcast, and they said that this YouTube video, it's called Procedure Ready OB-GYN, does a really good job about anatomy specifically for OB-GYN, which is it's very specific, and you have to really know what is going on. So this was a good resource that I read about. Our school likes Beckman and Ling's Obstetrics and Gynecology, and Sketchy has a section now on OB-GYN, which didn't originally while I was taking my classes. So that might be something you're into. A lot of these are video-based because I'm a visual learner more than anything. But I don't know, Kathy, if you have more as well, or you want to talk about any of them that really helped you specifically?
I think UWorld really helped me a lot, kind of doing some questions throughout. APGO, I know you kind of talked about there. I think those were a little bit more specific, but they were really they were a lot quicker. The vignettes were super easy compared to UWorld, so you could definitely hammer those through. Beckman's I completely used throughout the rotation, so I definitely concur through that. I like the podcast that you listed. I think I did listen to the Pimped OBGYN one, and there's even one that says first time in the OR or first time in a delivery, what things you can kind of do as a med student. And practice test, I completely agree. The MBMEs, I don't remember if those were pretty representative. I know there are some that are more representative than the others, but I know I did a decent amount for this rotation, so I concur with what you listed.
I'm not sure if either of you have heard of it. There's this other podcast called Creogs Over Coffee, and that's a really great one. They have tons of episodes about all sorts of different topics, but it was actually created by these two residents that are now MFM fellows, but they do both OB and GYN topics. But then they also do some life topics about how not to have burnout and things like that that are also really interesting. But I recommend that podcast as well.
Next slide. So some performance strategies, we divided into succeeding in the clinic as well as getting good evaluations. I think if you're doing well in the clinic, I'm not sure why you wouldn't get a good evaluation in general, but I do think that there are ways that we can focus on succeeding in the clinic, then that will lead you to a good evaluation. So some of the things that we mentioned are reading about patients before you present. In general, it's helpful. But I found that surgery L&D, it's going to be extremely helpful. Knowing your case, knowing where you're going in, it helps you narrow into what anatomy you need to learn for the day or review for the day. And then preparing a plan is something that I think is really helpful. Even they say this a lot in your rotations and you'll hear it a lot, but I think it takes about, I don't know, probably 100 times to hear it, that you really just come up with whatever ideas, like a plan that you have, and then that's where the teaching comes in. Your attending or your residents will go through why that's a great idea, or maybe we should try something else in this specific instance. But still, it's a good point that we're making, that we're thinking about all these other different things. One of the things that I was taught was that you should find out what the three main concerns are, if there are three, which most of the time there are, and then try to address those. If your presentation, you want to make sure that it's not super long. And then model your presentations by how you see your residents presenting, but also asking, how much detail they want in it versus not. One of the things that I learned was that OB-GYN is very quick. So our presentations were much shorter. They were to the point. Specific language was used to explain specific things. And that's something that you learn while you're on the job. And Kathy, did you want to go through the rest of it?
Yeah, just to add on to the clinic part, I will say something that helped me was I would prepare the night before, and I would read through the patient's kind of last note, because it's always continuity of care, and this isn't the first time they're seeing this specific attending or for this specific complaint. So if they had like an abnormal PAP, maybe seeing what the plan was last time, so then you can go prepared the day of clinic and be like, oh, so I know the plan last time was if this happened, then we were going to do this. So then you basically set yourself up with a plan. It's kind of a little bit of a cheat sheet, but you're reading up on the patient's story. Once again, something that I added was learning how to tie knots, because like I said, surgery was not before this rotation for me. So that's something that I wish I had practiced a little bit more. So I had more practice in C-sections. As far as getting good evals, I've always thought that having a positive attitude was honestly the best way to go. Being proactive, always wanting to learn. I've found that it does matter if you have your knowledge down. I agree. The foundations are very important, but if you're there early, if you're ready to learn, if you're ready to be part of the team and you're ready to see patients, that goes a long way. And even in rotations where I felt that I already knew that I wanted to do OBGYN. My last rotation was neuro, but OBGYN, there's a lot of neuro complaints in there. So I went in knowing that I wanted to learn as much as I could, because everything is applicable to a lot of fields of medicine. Preparing in advance, I kind of hit home on a little bit on that one. Effective communication, that's always important. You're part of the team. Make sure you feel like that, because they definitely see you as being part of the team. And feedback, definitely early in the rotation, so you can continue to kind of grow as a med student. You never want to be complacent, and getting that feedback early is definitely the way to go. And once again, I think I've said this before, but get to know your patients just as much as I say to introduce yourself to your residents and your attendings. If you're in pre-op, if you're going to be part of their delivery or in the office, you don't want to be the stranger that's going to be in their delivery. Try to see them earlier on and say, hi, my name's Kathy. I'm a medical student, or hi, my name's Kathy. I'm going to be part of your C-section. Don't worry, I won't be doing the surgery, but I'm just there to observe and learn. And they get to know who you are, and like I said, you're not this random stranger in the corner.
Dr. Ross, do you have any advice from an attending perspective?
Sorry, I was having a technical issue and I couldn't find my unmute button. Thank you. I think you guys have really covered all the important things. I can't stress enough the importance of having a positive attitude, especially if it gets toward the end of the year and you've decided what your career path is and you know that it's not OBGYN. Recognize, or whatever rotation you're on last, it's applicable no matter what your schedule is. Recognize that even though you've decided that field is not your chosen field, it is for the people who you're rotating with. Those faculty and those residents are very passionate about that thing. So think about that if you are speaking about the clinical topic, and don't talk about how boring it is or how irrelevant you think it is. Really, OBGYN specifically is applicable no matter what field of medicine you go into, because again, it deals with every human that has a uterus. So whether you're doing internal medicine, radiology, trauma surgery, no matter what you do in life, you're going to come across patients that are going to be on your OBGYN rotation. So you can find a thing that is directly applicable to your career path. So look for that thing and embrace it, and keep an enthusiastic attitude, and seek out ways to get involved, and enjoy the fact that this may be the only time in your life you get to deliver a baby. That's a very unique and exciting thing to be a part of. And I think everybody in medicine should have a chance to do that at least once. So enjoy yourself and have a good time learning the topics.
Next slide.
Also wanted to let you all know that it's 3:04 right now. We can stay for as long as y'all would like. Yeah, I just wanted to let y'all know the time.
Kathy, did you
Unfortunately, I
want
have
to
another thing that I'm supposed to be doing at 4 o'clock. So I was actually going to log off, but I would love to be available via email. I'll put my email in the chat. Once if I put my email in the chat, will all the participants be able to see it?
They should, hold on, let me stop sharing. Oh wait, no, I can see it. Okay. Yep, I think we see it.
Thanks. I threw my email into the chat. If any of you want to reach out, I'm happy to chat about this rotation or others and general advice. But thank you so much for giving me the chance to be here today.
Thank you for coming and for all your wonderful advice.
So I'm currently preparing for step 2. So I thought Kathy might want to.
Yes, I can definitely hop on this one. So I actually took step literally 7 days ago. So this is all hot off the press. Yeah. So I actually thought that OBGYN was pretty high yield for step 2. It was about 10 to 15%, definitely wide range of OBGYN topics. So if you're hoping to do well, then this is definitely something you want to have down. Clinically, like I mentioned before, it's very representative of what you see on your question banks. So definitely try to hone in on what's going on. I've always felt that once I see it in a patient, it's always really easy for me to remember, versus like in a question stem, then it's really easy for me to forget. Some things that I thought were pretty important, fetal heart tracings, very simple things. So like I know some of you guys haven't had your OBGYN rotations, but knowing the VEAL CHOP acronym was very high yield, I thought. Breast cancers and screenings, that goes with PAPs, any cervical screenings. A lot of times they'll give you like a 60, 30 or 40-year-old woman and be like, you know, she's just there for a routine checkup. What screening do you want to do for her? So knowing those guidelines is pretty important. Common labor and delivery complaints, so 3rd trimester bleeding, you know, what you would do, next step in management. I also thought that OBGYN was a little bit harder in limiting, like once you get down to 2 answer choices, they both sound right. So that's kind of where the hard part of OBGYN entails. Did I feel like continuous review was necessary throughout the year? I didn't think so. For me, I was obviously really interested in OBGYN, so it kind of stuck with me. But even if, you know, you have like OBGYN 2nd or 3rd, just like I did, it doesn't really overlap too much with the rest of your rotation. So I think once you kind of get into dedicated, revisiting those topics would be a good idea. The only topics that I thought, you know, it kind of overlapped with was maybe family medicine, once again, for the screenings. And then I had breast surgery on my surgery rotation. So I thought that there was some overlap there. But other than that, once again, just reviewing it in dedicated. And the best way for me to review for step 2 was just doing UWorld and looking up on ACOG. They have some like practice bulletin boards. So those are a little bit high yields. I thought it was a little bit outside of our scope because sometimes it's used by residents. But AMBOSS, you know, if you have the library, you can definitely look up topics there. And yeah, that's it for this slide.
Congrats on finishing step 2.
Oh, thank you. Oh my God.
So some final thoughts. So I thought one good piece of advice I got once was that you should consider at least one main goal that you want to work on during your rotation. So whether it's knot tying, writing notes, how to present, there are so many different things that you can hone in on. And if you communicate that that's the skill you want to really work on, then you will get better, more specific feedback about it. And we talked about getting to know all the clinical team members. I wrote that I think it's really important to, have some time for yourself. And if you like to journal, then that is a really good way of getting that time for yourself. Specifically when you come to the end of third year or somewhere along and you like everything like me. If you keep a list of the things you like, things that you don't particularly like, or something that you can't see yourself doing for the rest of your life, like whether it's just this one task. If you keep a running list of those things and you still don't know where you want to be in the end, you can look back at it and see, oh, that's what I liked. And because the year goes by pretty quickly, but it's so much that it just helps to have something to go back and look at.
I completely agree. And if you're anything like me and you don't really like every other rotation, but you specifically like one, I think it's important to remember that no rotation is perfect. There are going to be some things that you like or you don't like. There's things about OBGYN that I don't specifically like, but that's okay because I can, curate my practice later on as an attending to something that I do like. But I think knowing that the bread and butter, if you at least like the bread and butter and you see yourself doing that. And I know that when I was on, neuro or psych or surgery, I was always like, man, I really wish I was on L&D right now. I think that's a telling tale. I was actually between peds and OBGYN for a little bit. And I think there's this saying that, in a delivery, if you ever see yourself wanting to follow baby, then that's a telling tale that you want to do peds. But if you want to stay with mom, then that's a pretty big sign that you want to do OB.
Awesome, y'all. Yeah, questions. I also noticed in the chat that Bianca had a question about step 2. Do you have a favorite overall review book for step 2? Heard that first aid isn't that great.
I did not use first aid. I used Master the Boards. I thought it was pretty true to the point, exactly what I kind of needed. Sometimes it did leave some stuff out, like I was doing a question and then it didn't cover exactly what was there. So then I would use the Amboss library. I thought the Amboss library was great. I could just kind of look it up really quick, and not specific to OBGYN, but step 2 overall. Honestly, my biggest piece of advice for step 2 is just, keep doing questions, keep doing that repetition. You tend to know what they ask for. There is a lot of the risk factors, kind of like if this patient has this, then what are they most at risk for? And sometimes it's not the common things. So, throwing out there. And there was a lot more ethics than I thought there would be. Definitely a decent amount of abstracts. So know how to take advantage of time with those. And there was a decent amount. I took mine July 2nd, so 7 days ago. Decent amount of SOAP note format questions, more than I was expecting. Not really vignettes, but kind of they gave me the patient's demographics, HPI, kind of bullet points, but I wasn't expecting that. So just be aware of that. Yeah. Let me know if you guys have any questions. I'll feel free to answer them in the chat.
I'm just studying now, but I'm actually taking notes. Thanks, Kathy. But the one thing that I am starting to look into is the Divine Intervention podcast. I have just learned about it and I'm about to start trying to see if I like that. So I'm getting a big, nice head shake from you, Kathy. So I think I'm going in the right way.
Yes, specifically for the risk factors. he has like 3, send me a message, girl, or I can put it in the chat. And I can try to find it, but he has 3 that I heard were pretty high yield. So I listened to it like the week before my exam. And I think I blacked out most of that exam. It was 9 hours of torture, but I did feel a little bit more prepared knowing that I had listened to the, risk of, and even when I was doing practice questions, I did feel like he helped me answer some of those questions. So hopefully he helped. We will see. I'm seeing a couple more questions. Do you mean the questions include research abstracts? Yes, it's torture. It's kind of like summarized abstracts, but they go through a patient comes in with breast cancer and they're asking you about a new chemotherapy drug. And then they're like, here's the abstract for it. And then it's definitely shortened down version, but there's charts. Sometimes there's even drug ads. So you have to be able, they're trying to like see if you can interpret those research topics, interpret kind of charts, relative risk ratios, confidence intervals. So biostats is definitely pretty high yield for step 2, I thought.
I think is the question about when did I start studying or when Kathy, probably Kathy.
I think we can cover both, Wendy. So my rotations ended I think at the end of May. And then I thought that 4th year, they give you a lot more liberty to kind of structure your dedicated. You can kind of structure your schedule with whatever way you want it to. I wanted to start my AI pretty early, so I'm actually in the middle of my AI as we speak. For those that don't know, an AI is what you do as a 4th year. You're kind of like an acting intern. So with that being said, I really only had 4 weeks to study for step 2. With the caveat that 3rd year, you are basically already studying for step 2 as you're taking your shelves. You're doing UWorld the whole year. So I thought step 1 was traumatic for me. So I thought step 2 was a lot easier to get through, a lot more clinical, less like of that basic science course stuff. So a lot more manageable in general. I thought 4 weeks was enough. Any more than that, and I feel like I really would have gone crazy because you're really just getting off that 3rd year kind of home stretch.
Yeah, I'll have a total of 4 weeks as well. And then I'm starting my AI right afterwards. So I think in general, you need to find out what you need and how long that is. And your institution will most likely, I don't see why they don't help. They want you to pass. So just reach out, know who to reach out to, and earlier the better if you do need more time.
Completely agree. And I'm so sorry to burst the bubble on step 1, but yeah, it was traumatic. You'll be fine though. I promise you, you will get through it. I'm going to put my email in the chat just so you guys can reach out to me. Definitely not a plug, but if you want to follow me on social media, I really do tend to cover a little bit more like medicine stuff and like OBGYN. So if you're interested in OBGYN, like shoot me a DM or like you can see like kind of what we do, what it entails. I think it's a little hard for me to kind of talk to you guys, but if you really see it. So I'll put my email in there and I'll put like my username to most of my social media stuff. And yeah, good luck to everybody.
Yeah, I'll put my email as well. Feel free to reach out to me if you have any questions and I can help.
Thank y'all so much for your time. And yeah, best of luck to all of y'all for 4th year and everyone else for the rotations in 3rd year. I know y'all are going to be amazing. And yeah, can't wait to see what y'all do.
Yeah, likewise. I'll see you guys in the hospitals. Take care.
Bye, everyone.
Bye.